My father actually passed away from cancer. So it kind of motivated me to go into the field. And since I'm already in the pediatric side, I decided to join additional training in pediatric hematology and oncology, and hoping that it still bridge the my interest and also my passion in pediatric or childcare, along with my interest in rare disease, especially for children affected with cancers and blood disorders. I see both adult and pediatrics. As clinical geneticist, I mainly take care of patients with rare disease that has an underlying genetic reason for it. I do a lot of preventive type of works, and related to genetics, I actually see mostly patients, adult and pediatrics, with a genetic condition that put them at risk to get cancer. So we built this cancer predisposition clinic at Cleveland Clinic, where we identify patients who are born maybe with a genetic condition that put them at risk to get cancers, and how we can follow them and do appropriate surveillance and monitoring so we can detect the cancers earlier and treat it quicker. My role is to basically follow this patient who is currently do not have any cancers, right? So they are actually not really a patients. They actually have a genetic condition that put them at risk. So I follow them with regular monitoring, either maybe scans every so often. And when we find something, since I have a background in oncology, I will be able to help reviewing those results and interpreting those results, and then make the most appropriate treatment, whether or not treatment, diagnostic workup. And if the patient eventually formally diagnosed with cancers, I usually pass it along to my colleagues in oncology who will treat the patients. As geneticists, we are sort of like an investigators, like a detective, and many of these patients have been seeing so many different providers, right? And they are frustrated, and they're just trying to get an answers, and it's so rewarding when you find the answers, although it might not change the way we manage them, but having a closures, knowing what causing your problem, it's still helpful, because I believe that knowledge is power, and you are empowered to know more about your health and how you can be proactive on preventing disease to happen from the first place.